Welcome. Thanks for joining us again for another episode of Oklahoma Health News powered by OU Medicine. I'm Jennifer Schultz, Senior Vice President of Marketing and Communications for OU Medicine, and very excited to have back with us today a familiar face for all of us, Dr. Dale Bratzler, the Chief Quality Officer for OU Medicine. Thank you so much for taking some time out of your busy schedule to talk with us today and just give us kind of an update about where we're at with COVID-19.
Okay, good morning. It's really a pleasure to be here today. So as of yesterday, we have about 50,669 confirmed cases in the state of Oklahoma. Over the past week, there have been about just over 4,500 new cases that have been diagnosed over the past week. And sadly, we had 71 Oklahomans lose their life to COVID-19 in the past 1 week period. We've been on a steady downward trend since about mid-July, late July. Although I will highlight that over the past 2 weeks, that downward trend is starting to flatten. We're perhaps at a plateau. But right now, we're seeing on average about 650 new cases each day in the state. So 3 weeks ago, we were at around 1,100 new cases per day in Oklahoma. So that's really good news that we're down to about 650. But over the past, particularly the past week, we've been bouncing around very close to that 650 range. And so it almost seems that we're plateauing again. And as we've discussed, we can't let our foot off the gas now. We have to keep doing all those public health interventions that will help us slow the spread of this disease.
What do you think are some of the big factors that took us from 1,100 a day to about 650 a day? That's almost half, cut it by about almost half. What are the key things that we've been doing?
Yeah, so I think when you look at what did we change in the state, about the only thing that really has changed substantially is that many communities in Oklahoma now have a mandate or ordinance to wear a mask. So particularly our two largest metroplexes, Tulsa and Oklahoma City, where we've had mask ordinances now for a little over 3 weeks. Those have, I think, had an impact. Also, again, a shout out to all the corporations, the corporate retailers and others that put into place mask mandates. Companies like a Walmart, CVS, Walgreens, Home Depot, all of those places that a lot of people go to, even in communities that don't have mask ordinances. People, I think, have gotten a bit more used to wearing a mask because it's required when you go into some of those businesses. And again, a shout out to the small business owners in Oklahoma, because I know there are many in Oklahoma that have required wearing masks. So if you look, we haven't really changed anything else in the state other than the fact that we have a lot of communities wearing masks now, and I think that's why we're starting to see some downward trend in the number of cases.
So with that downward trend in the number of cases, I know at one point we talked a little bit about maybe a misnomer that young people weren't getting the virus or they weren't that sick. We've talked a lot about how they were getting the virus and they were sick. Do we have a lot of hospitalizations in Oklahoma, or are people mostly just kind of lightly sick with COVID at home?
So let's take both of those issues. So kids definitely do get this infection. I want to make that absolutely clear. The American Academy of Pediatrics this past week announced that more than 400,000 children in the United States have now had a confirmed case of COVID-19. So,
and they're getting pretty sick at times too. Is that correct?
Sometimes they can get very sick. Again, they don't get sick nearly as often. They're much less likely to be hospitalized, and thankfully, deaths are rare. But we know that there are reports of childhood death from COVID-19. So again, we can't be complacent about that at all. So we're up to 400,000. That's out of the more than 5 million cases in the United States. Again, kids don't get it as often, but they definitely do get COVID-19. With respect to hospitalizations in Oklahoma over the past 3 weeks or so, the numbers may have trended down just a little bit, but we're pretty much flat right now in terms of hospitalization. So I think yesterday there were 466 people with a confirmed test, positive test, that were in the hospital with COVID-19. And very sadly, half of those patients that are in the hospital were in the intensive care unit. And when you look at published data on COVID-19, anywhere from 20 to 30% of the people who've been sick, at least historically in the published literature, who were sick enough to be in an ICU with COVID-19 actually died from the disease. So because we have so many people still in the hospital, particularly in an ICU bed, I think we're going to continue to see some deaths from this disease in Oklahoma.
Now, we're several months into this now, and I know there's people, I hear about COVID fatigue where people say, oh, so tired of talking about it and it's impacting my life. One of the things that I think I've experienced is that the masking piece actually helps me to be able to do more things, like go to the grocery store and what have you. What are some of those other tips and tricks that just seem to be kind of the steady, tried and true things that are helping us to protect ourselves from the virus?
Well, I think, it's really important that we role model wearing masks. So you and I are sitting here today wearing a mask, even though we're physically separated. But we're doing that as partly to role model wearing masks, and I think more people need to do that. I think that's where I see the real benefit of corporate America that stepped in and said, this pandemic is really hurting businesses across the entire country, so we're going to start mandating masks in our businesses to help slow the spread of the virus. I think it's having an impact because, again, even if your community doesn't have a mask mandate right now, you may have a Walmart or one of the other, a CVS, a Walgreens, or one of the other stores that actually do have mask mandates, and I think people are getting more used to it. I think I pointed out before, I just walked across campus from the College of Public Health. There was nobody outside. I was on the sidewalk. And yes, I would feel comfortable not wearing a mask in that setting. So I just wear a mask when I walk anywhere on this campus now. I just don't take it off because I'm used to it now, and I think more and more of us are getting used to it. The other thing I want to highlight is that the Oklahoma chapter of both the American Academy of Pediatrics and the Academy of the Family Practitioners have come out with guidance for schools, but they're very explicitly recommending that school-age children wear masks, and kids actually can do this very well. There are lots of really neat masks that are fun for kids to wear. I've highlighted before my granddaughter, she's 4, she goes to a daycare. She wears a mask every day, but she knows why. She's just gotten used to it. It's part of her, her upbringing now, and her parents have modeled it.
So one of the things that makes me think of is, kids going back to school and all of the different things parents should be thinking about with that. What are some of the things that you would say parents could consider that would be helpful in getting their kids through this time and even making them have a comfort level with wearing a mask?
Well, so again, I think parents have to role model it first. They need to not talk it down. They need to encourage the kids. They need to make it fun. They need to make it fun for kids to wear a mask. And actually, I think kids are smart enough oftentimes to understand you're wearing a mask so you don't give an infection or you don't spread something to somebody else that you're close to. I think kids can actually understand it, and I know there's a lot of good educational resources out there for parents that are working with their kids to get them to wear a mask. Also in our schools, again, I've been a strong advocate for having mask policies in all of our primary and secondary schools because I think it's really important not only to slow the spread of the virus from one child to another, but also then to protect the staff, the faculty, and others that are teaching in our schools. And remember, when kids get the virus, and they will, if they go home, they give it to their parents or their grandparents. And so again, wearing a mask is about keeping everybody safe. And I think kids can do it very effectively. And we as adults, we need to role model it right now to make sure that they understand that.
So I know that you and your colleagues have been studying all aspects of COVID-19 since way back when we first heard about it. Not only, the epidemiology of the virus, but treatment therapies, vaccines, cures, all of those different topics. I'm wondering if there's any new developments that you have started to evaluate and look at with the virus as of late.
Well, so most of the stuff that I'm looking at right now is how can we make testing more broadly available, inexpensive, easy to do. Ideally, we'll get to some type of a rapid COVID test that you can do at home, that you can do easily at home, get the results really quickly. We know that most of those really rapid tests, the sensitivity isn't as good. In other words, some people with an infection may get a negative test, but if it's inexpensive, you can do it frequently. So if you don't get better, you repeat it in a day or two. And that's where we need to get. We need really broad-scale testing so that when somebody knows they're positive, they can self-isolate and not be around other people to slow the spread of the disease. So that's where a lot of the current research is focused on. There obviously is ongoing research in multiple areas of treatment for COVID-19. Right now, there still are a limited number of drugs that have been shown in the gold standard randomized trial to actually show that these drugs actually reduce mortality. The care in hospitals has gotten better. Our intensivists know much better ways to keep these patients alive. So mortality for those hospitalized patients has actually gone down because we're better at taking care of them. And there are still trials ongoing for things that we think may be helpful, but we don't know yet. So the one that comes to mind is convalescent plasma. We have lots of survivors of COVID-19 donating plasma. I encourage that, but just recognize at this point in time, that still hasn't been proven as a treatment for COVID-19. Those trials are still ongoing, and it's going to take a little longer to get that. Of course, the other big area of research is now vaccines. There are multiple vaccines now that are in what we call phase 3 clinical trials, where they're being done with large numbers of people, up to 30,000 individuals per study. And we're all hopeful that some of those vaccines will be proven to be both effective at stimulating an immune response, but also safe so that you can feel comfortable taking the vaccine. And the one thing that I completely agree with the way the administration has set up is the fast tracking of the manufacturing capabilities. So if a company develops a vaccine that works, it's safe and effective, they can go immediately into production as soon as they complete those trials. I still think it's going to be after the first of the year, though, before we see any distribution of new vaccines.
Well, that was my next question, was how long you thought we'd have to wait for that. So maybe dovetailing into that, when, let's say that we find a vaccine and it's in mass production, how do you think we would go about kind of distributing the vaccine? I know that's something a lot of people have asked, is how would I be able to get the vaccine?
Right. Well, I think, there are a lot of conversations going on right now about how vaccine recipients might be prioritized to get the vaccine. So, as an example, healthcare workers that are on the front line, ICU doctors, emergency room doctors, paramedics, nurses, people that are on the front lines of taking care of people with COVID for whom have such great risk of potentially getting the virus, they might be a high priority group to receive the vaccine first. I think we're going to have to see how the vaccines work in the elderly. Because even in Oklahoma still we're having nursing home outbreaks of this disease. So if there was a vaccine that we could distribute to all the nursing homes in the state and substantially reduce transmission and infection in the nursing home, we know that those people, when they get this infection, are at much greater risk of death than a young person who gets the vaccine. So I think there'll be some prioritization for the people who have risk factors, patients with chronic lung disease, diabetics, liver, kidney disease, things like that. The healthcare workers, the elderly that are at high risk, I think that's how it'll be prioritized first. So you're young, you're probably healthy, you might be a little bit lower on the list to be upfront to receive the vaccine.
So, I think just maybe a couple thoughts or questions in closing. It's Oklahoma. The weather's been beautiful today, so there's a lot of outdoor activity that's happening. We've talked a lot about outdoor activity being something that has other safer alternatives. What are some of the things that you would tell people about as we move into fall and we're outdoors and there's maybe some fatigue with COVID? What are the kind of silver lining or rays of hope or tips that you'd give them around maybe vigilance with our work with COVID-19?
Well, as you mentioned, I mean, this is an ideal time to be outside in Oklahoma. We're about to approach fall, which I think is one of the best times in Oklahoma. I strongly encourage people to do outdoor activities, to stay physically active. you do need to avoid crowds. Obviously, getting around people too close, particularly if they're not in a mask. I think that's important. But if you're outside, you're physically distanced. You don't have to wear a mask in that setting. I think that's quite appropriate. When I'm out brush hogging on my land, I don't wear a mask when I'm on the tractor. I feel quite comfortable there. So there are a lot of activities that we can do outside that are quite safe, that you don't need to wear a mask and things like that. And so I think it's a nice reprieve. Somebody talked about children the other day. Of course they can go out. They don't have to wear a mask if they're out in your yard playing and doing things that kids do. It's only if they get around crowds of kids or other people that you need to be worried about it.
You know, that gives me kind of one final question that comes to mind, talking about being outdoors, wearing a mask in crowds. So if I am in a crowd and everybody's masked, is that a okay safety measure, or is there still the component of needing to be physically distanced even when you're in a mask?
Well, so both interventions have been shown to be very effective at preventing person-to-person spread of the virus. So I will tell you, on our Norman campus, where we're going to have 26,000 students in the very next week, in fact, we allow people who are outside who can physically distance more than 6 feet apart to not wear a mask. There's nothing wrong with wearing a mask if you want to, but we don't require it if you can maintain that physical distancing, because studies have shown that most of the transmission of this virus from one person to another is when you're close and you're not in a mask. That said, if you're outside and there are a crowd of people around, then I strongly encourage you to wear a mask, because that reduces not only the risk that you might give the virus to somebody else, but that you might inhale the virus from somebody who is close to you. So again, when I'm outside now, particularly on campus, I don't do it when I'm out on my land and things like that, but when I'm here on campus, I just wear a mask. It's just easier.
Yeah. Well, it's always so great to talk with you. Very, very helpful information for all of us. We thank you so much for your time. We are going to be back here next week with more topics on Oklahoma Health News. We always like to tailor these to what you're interested in, so give us a direct message or comment in the comment section, but we will be back here next week, and thanks for joining us.